So if you have EDS or Ehlers-Danlos Syndrome, this is probably important for you because it's something that we're running into a lot in the clinic and I haven't shared it much in public. But something to consider is a lot of bite and scoring, which is kind of where you're looking to see how flexible you are. You get a score based on different body parts, and that's kind of how generally people get a diagnosis. And then there's the genetic testing that goes beyond that, and it tells you kind of to what degree or what genetic variant that you have, right? But a thing to consider and that we have to pay attention to, especially in the world of dysautonomia, especially in the world of concussion and brain injury, is that we also want to pay attention to the tonality of our muscle, or the muscle tone that people have. Sometimes people have spasticity or increased or hypertonic muscles, right? But that's not necessarily EDS people. EDS people, we also have to be worried about confounding people that have hypotonia, where their muscles are at a lower tone than normal. And if they're at a lower tone than normal, it allows us to exceed the normal barrier tensile forces in joints. So people that have cerebellar disorders, for example, where we have ataxias, or people with dysmetria, you'll see they might have tremor in their head or in their trunk, but they will also tend to be hypotonic. Their reflexes will be less. When you see them move, you also notice that they tend toward the end range of their joint, much like somebody with EDS. So what we pay attention to is the fact that some people will be diagnosed with EDS based on a simple scoring system, right? But what we're actually seeing is hypotonia that's being generated by the cerebellum, which can have all these other different types of symptoms that are associated, which can be things like problems with autonomic function, problem with their balance, or feeling dizzy, or with their eye movements, or tracking, all of these things. So we want to be very careful that we're not tossing everybody into the EDS bucket while overlooking people that have a neurologic basis in hypotonia. So if that's you, very important to think about, very important to solve for. Thank you.